Hello and welcome back to class. This is Applied Anatomy and Physiology, AAP 301 for the College of Natural Health Sciences, Bermuda. My name is Dr. Delcina Bean Burrows, and this is lecture number 9. And today we will be looking at the endocrine system. In today's lecture, we will consider the learning objectives, key terms, hormones, endocrine glands and tissues, the stress response, aging, and the endocrine system. Before we get started, some points to consider. Some people scream on roller coaster descents while others laugh uncontrollably. What could explain this difference? After the ride, some people appear pale or ashen, while others are excited and invigorated. What could cause these different reactions? And the learning objectives for Chapter 9 are that at the end of today's lecture, you will be able to list the functions of the endocrine system and discuss their importance in relation to the practice of manual therapy, name and locate the major endocrine glands, compare and contrast the communication and control functions of the nervous and endocrine systems. Explain what hormones are and describe their role in endocrine system function. Explain the mechanisms of action for water and lipid-soluble hormones and identify which uses the second messenger mechanism. Explain negative feedback and the primary methods of stimulating hormone release. Name the hormones secreted by each of the endocrine glands and describe at least one key action of each. Explain the physiological processes involved in the body's stress response and discuss the changes that occur in endocrine function as the body ages. And some key terms that we will discuss are androgen, catecholamine, corticoid, endocrine gland, exocrine gland, glucocorticoid, hormone, lipid-soluble hormone, mineralocorticoid, negative feedback, second messenger mechanism, stress response, and water-soluble hormone. So let's begin our discussion about the endocrine system. The endocrine system works with the nervous system to control and coordinate body functions. It is a chemical messaging process center. It uses slower but consistent feedback loops to read, adjust, and readjust reactions. The techniques for stimulating major glands and organs include zone and meridian therapies. Here we see illustrated the foot reflexology map. Major glands and organs of the body are represented as specific zones or points on the feet. In reflexology, digital pressure is used over these points to stimulate change in the correlating organ. Manual therapy can have indirect effect on the endocrine function through impact on the autonomic nervous system. Hormones are specialized chemicals that act as messengers on target cells. They are regulated by multiple physiological responses. Most hormones circulate through the bloodstream. There are two categories of hormones: water-soluble hormones and lipid-soluble hormones. There is a definite mechanism of hormone action. Hormonal secretion is controlled by the endocrine gland. The endocrine glands are stimulated by metabolic changes by secreting hormones into the bloodstream for circulation through the body. target organs have hormone-specific receptor cells that are stimulated by that hormone to produce cellular changes, which is the physiologic response. While water-soluble hormones are easily transported through the blood, they cannot pass through the plasma membrane of target cells due to the phospholipid structure of the membrane. Instead, water-soluble hormones are recognized by receptors on the surface of the cell membrane called integral membrane proteins, IMPs, which bond with the hormone. The connection between hormone and receptor activates an intracellular protein called a G protein, which initiates the conversion of ATP in the cytoplasm into cyclic adenosine monophosphate or cyclic AMP, which is small c, big AMP. The presence of CAMP, in turn, activates proteins within the cell that produce a designated physiologic change. This sequence of events is called the second messenger mechanism. In the second messenger mechanism, the hormone acts as the first messenger, delivering a chemical message to the receptor IMP. This action is similar to a bicycle messenger delivering a package to the front desk of a large office. The receptionist signs for the package, activation of the G protein, and then hands it off to an assistant, the second messenger, who delivers the package to the employee for which it is intended. That employee is the person who will act on or respond to the contents of the package. In the cell, the CAMP serves as a second messenger, activating the special proteins that produce the target physiologic response. Since the majority of the hormones are water-soluble, the second messenger mechanism is the most prevalent method of hormone action in the body. Let's now consider the mechanisms of hormone action. Lipid-soluble hormones travel with carrier molecules in the blood to pass through the plasma membranes to bond with the receptor. The intensity of the target cell's response depends on concentration of hormones and the number of available receptors. There is what we refer to as a synergistic effect, an antagonist effect, and a permissive effect. Let's now consider the control of hormone secretion by first looking at the negative feedback mechanism. A stimulus causes the endocrine gland to release a hormone. The physiologic response of the target cells to the hormone ultimately counteracts the stimulus that caused the hormone's initial release. In terms of the positive feedback mechanism, there are three ways endocrine glands are stimulated to release hormones. The first is hormonal stimulus. The second is changes in blood concentration, and the third is by way of a neurologic stimulus. In terms of hormonal release, many glands are stimulated by hormones from other endocrine glands or tissues. The relationship between the hypothalamus and the pituitary is a prime demonstration of this phenomenon. The hypothalamus releases stimulating and inhibiting hormones that control the function of the pituitary. When we consider changes in blood concentration in other endocrine glands, a change in the level of a specific ion or nutrient in the blood stimulates hormone secretion. Calcitonin, released from the thyroid gland, is an example of this sort of stimulus. And in terms of neurologic stimulus, in a few cases, neurons stimulate specific glands to release their hormones. The relationship between the hypothalamus and posterior pituitary and the sympathetic stimulation of the adrenal glands are examples of this type of endocrine gland activation. And here is our What Do You Think segment. Besides the endocrine system, what other system uses the terms antagonist and synergist? How does the meaning of these terms differ? What would happen if hormones were not target specific? Give an analogy for the negative feedback mechanism using everyday objects or activities. Now for this segment, you do not have to submit anything. However, it is a good practice to quiz yourself to make sure that you are understanding the information and that you are integrating the systems of the body as you study. Now let's consider the relationship between endocrine glands and tissues. While many organs, including the heart, kidneys, and small intestine, release hormones, the major endocrine glands include the pituitary, pineal, thyroid, parathyroids, thymus, adrenals, gonads, which are the ovaries and the testes, and the pancreas. Unlike other body systems, the endocrine organs are not structurally linked, although they are dispersed around the body. The system's individual glands and specialized tissues function together to secrete hormones directly into the blood and lymph. Endocrine glands are ductless, in contrast to exocrine glands, such as the sebaceous glands in the skin and the salivary glands, which have ducts that deliver their secretions to specific locations. The pituitary, pineal, thyroid, parathyroids, thymus, and adrenals are endocrine glands. The pancreas and gonads have dual functions as both endocrine and exocrine glands. Table 9.1 provides a summary of the major endocrine glands, their hormones, and the key physiologic responses that they stimulate. And here we have more of table number 9 about the endocrine glands, their hormones, and their actions. It should also be noted that endocrinologist Hans Selye is widely acknowledged as the father of modern stress research. His groundbreaking work shows that our physiologic responses are the same whether we are experiencing a positive or negative stressor. In fact, he coined the terms eustress and distress. When we consider manual therapy applications, we as holistic health practitioners have a deeper appreciation as to how the endocrine system impacts the mind, body, and spirit. Let's now consider the hypothalamus, the pituitary gland, and the pineal gland. All of these structures are located within the brain. The hypothalamus oversees all neuroendocrine functions and produces several hormones, some which are stored in the pituitary. The pituitary, which is known as the master gland, produces hormones to stimulate other glands. And the pineal gland secretes melatonin, and some of its functions are still not completely known. And here's another What Do You Think segment. How does your understanding of the relationship between the hypothalamus and pituitary support your understanding of the mind-body concept of health and well-being? Do you agree with the name master gland for the pituitary? Why or why not? Let's now consider the thyroid and the parathyroid. The thyroid gland is anterior to the trachea and just inferior to the voice box, which is the larynx. The parathyroids are nodes located on the lateral posterior aspect of the thyroid. The thyroid gland itself is a highly vascular tissue mass located on the anterior neck. The soft lateral lobes of the thyroid gland are connected to the isthmus. With training, manual therapists may be able to palpate these lobes on either side of the trachea, just inferior to the voice box. This important endocrine gland secretes thyroid hormones, which are essential for regulating cellular metabolism, and calcitonin, which plays a key role in the regulation of blood calcium levels. There are two variants of thyroid hormone, each identified by the number of iodine atoms. The parathyroid glands are located on the posterior aspect of the thyroid, and they secrete parathyroid hormone, also known as PTH, which works as an antagonist to calcitonin. In contrast to calcitonin, PTH release is stimulated when blood calcium levels are low. PTH stimulates bone resorption by increasing the number and activity of osteoclasts. This increases the breakdown of bone matrix to release calcium ions from the bone and release blood calcium levels. A secondary effect of PTH is to stimulate the kidneys to release calcitriol, the active form of vitamin D, which accelerates absorption of calcium from the digestive tract to the bloodstream to further increase calcium levels. PTH also increases resorption of calcium ions in the kidneys. The thymus is located in the thoracic cavity under the sternum. It shrinks after puberty. The pancreas is located behind the stomach in the medial aspect of the upper left abdominal quadrant. While its dominant function is as an exocrine gland in the digestive system, it plays an essential endocrine role as well. The endocrine functions of the pancreas originate in a group of specialized cells called pancreatic islets, or islets of Langerhans. These islets are interspersed throughout the organ and function like tiny individualized endocrine organs. Each islet contains 4 types of hormone-producing cells, 2 of which are primary importance: the beta cells, which produce insulin, and alpha cells, which produce glucagon. Insulin and glucagon work as antagonists in the regulation of blood glucose levels, with insulin decreasing blood glucose levels and glucagon increasing them. The adrenal glands, also called the supraadrenal glands, sit directly on top of the kidneys. Each gland has 2 regions that function as independent endocrine glands. The outer region, the adrenal cortex, secretes steroid hormones called corticoids. The inner or central portion of each gland, the adrenal medulla, secretes a group of hormones called catecholamines. While the cortex has 3 regions that produce different corticoid hormones, the medulla produces the catecholamines adrenaline and noradrenaline. And here we take a closer look of the hormones of the adrenal cortex. There are 3 layers of cells that secrete different corticoid hormones. The outer layer secretes mineralocorticoids. The middle layer secretes glucocorticoids, and this is the cortisol and the effects of cortisol. And the inner layer secretes androgens. The hormones of the adrenal medulla secrete adrenaline and noradrenaline. They play a major role in response to stress, and they are designed for short-term adaptation. The ovaries and the testes are referred to as gonads. They are responsible for maturation and function of reproductive organs and physical traits that differentiate the sexes. The hypothalamus stimulates the anterior pituitary to release FSH and LH. These gonadotropins stimulate the ovaries to release estrogens and progesterone and stimulate the testes to release testosterone. Now let's discuss prostaglandins and other local hormones. Prostaglandins alter fat metabolism, reduce the intensity of pain, promote fever, and enhance the inflammatory response. Some hormones are released directly into neighboring tissues to affect the immediate vicinity. And now it's time for another segment of What Do You Think? These segments are designed to make you think critically and clinically about your practice as a holistic health practitioner. What effect would removing the thyroid gland have on the body? How are calcitonin and PTH similar to insulin and glucagon? Based on your understanding of the hormone cortisol, what do you think is the purpose of cortisone injections and creams? Let us now consider the stress response. Our bodies have to respond to billions of forms of stimuli on a daily basis. Stimuli such as fluctuations in temperature, hydration, blood pH, and respiration are all managed through normal homeostatic mechanisms. But when the stimulus is unusual or perceived as excessive or disruptive, it prompts the hypothalamus to initiate a group of physiologic responses collectively referred to as the stress response. The stimuli or stressors that create this response vary widely from one individual to another and can be initiated by physical events or psychological perceptions. When people talk about being stressed out or under a lot of stress, they are referring to the negative aspects of stress called distress. Distress includes anything that angers or frustrates us or drains our strength, stamina, or creativity. Although positive challenges or stress, called eustress, cause the same physiologic responses within the body, these are psych us up and increase our productivity levels. Situations such as exercising, receiving a surprise of good news, and getting married are examples of eustress. Whether experiencing distress or eustress, the hypothalamus initiates the stress response by simultaneously engaging the nervous system in the alarm response and the endocrine system in the resistance reaction. The hypothalamus initiates the short-term response of the sympathetic nervous system as well as the long-term resistance reaction of the endocrine system during the stress response. Let's take a look at the alarm response aspect of the stress response. With the alarm response aspect of the stress response, there is hypothalamic stimulation of the sympathetic response of the autonomic nervous system. There is increased heart rate, blood pressure, sweat production, respiration, and catabolism for energy production. There is also decreased digestion and urine production. And the adrenal medulla is stimulated to support and prolong the responses. Now let's consider the resistance reaction aspect of the stress response. The resistance reaction creates links between the hypothalamus, pituitary, and adrenals to release hormones to help the body continue its fight after the alarm response is gone. Neuroadaptation occurs as well as allostasis to keep the body functioning through long-term stress, although this is not ideal. In terms of manual therapy applications with respect to the resistance reaction, it is currently unknown how manual therapy helps reduce stress and anxiety. Studies have shown, however, that manual therapy reduces pain, improves sleep, enhances our sense of well-being, decreases depression and anxiety, and improves resilience to stress. Let's now consider exhaustion in terms of the stress response. Generally, the body's alarm response and resistance reaction manage most of life's stressors. But when either duration or intensity of a stressor is too great, the body suffers a depletion of its resources to the point of exhaustion. Prolonged exposure to cortisol and other stress hormones leads to muscle wasting, suppressed immune function, and other organ system pathologies. Eventually, the body simply gives out and shuts down. In fact, the Japanese have a word for it. It is called karoshi, which means death caused by overwork. It's time for another segment of What Do You Think? What characteristics would you use to describe individuals who call themselves adrenaline junkies? What are some possible negative effects of being an adrenaline junkie? And how would you use manual therapy skills to maximize stress reduction effects? Now let's take a look at aging and the endocrine system. Aging adults tend to be less resilient to stress and show increased susceptibility to disease, sometimes referred to as homeostasis. Many of the physical changes associated with aging are related to changes in the endocrine system. These changes include decreases in the following: bone density. As we age, bone density decreases, leading to osteoporosis and increased risk of fractures. This arises as the thyroid gland produces less calcitonin and the parathyroid glands increase their production of PTH. Females tend to experience greater changes in density after menopause when their ovaries decrease estrogen production. Muscle mass. A decrease in the production of GH by the pituitary gland contributes to muscle atrophy. This, together with a reduction in resistant type exercise, decreases overall muscle mass. Metabolic rate. The thyroid gland decreases its production of thyroid hormone, which lowers the metabolic rate. When decreased metabolic rate is coupled with decreased muscle mass, it is no wonder we often have trouble keeping warm as we become old. Resistance to stress. The adrenal glands decrease the production of aldosterone and cortisol. Together with decreases in GH and thyroid hormone, the body's resistance response is greatly diminished. This explains reduced resistance to stress, including injury and disease. Other changes in endocrine activity include a decrease in insulin production combined with decreased receptor sensitivity to insulin in body cells. This is why blood glucose levels climb swiftly after eating and take longer to return to normal, making older adults even more susceptible to type 2 diabetes. In terms of one pathology alert, we can consider endocrine disorders as being either hypo or hypersecretion of a hormone. Hypo means that there is too little production of a hormone, and hyper means that there is too much or an overproduction secretion of a hormone. And in terms of our pathology alert, let's take a look at diabetes mellitus. Diabetes mellitus is a disorder of insulin action and or secretion that results in high blood glucose, which is hyperglycemia. It is classified as either type 1 or type 2. Type 1, once referred to as juvenile diabetes, involves insufficient production of insulin from the beta cells in the pancreas. This type represents about 5 to 10% of all diabetes cases. As an autoimmune disorder, type 1 diabetes is caused by several factors, including genetics and certain drug or chemical exposures, but its origin is often unclear. Type 1 diabetes is managed through regular insulin injections and requires a strict diet and lifestyle to be in compliance. Type 2 diabetes represents the remaining 90% to 95% of all cases in which insulin production may or may not be an issue. In some people, long-term diet high in simple sugars and carbohydrates has overwhelmed the pancreas, causing the beta cells to become less efficient at producing insulin. In others, insulin production remains normal, but there is simply too much glucose in the blood to be processed. Or, insulin production is normal, but target cells have downregulated, providing few insulin receptor sites. It is also possible that there is a combination of both low insulin production and low sensitivity. Type 2 diabetes is often managed through stress management and changes in diet and exercise. Sometimes oral drugs and or insulin are prescribed. People with diabetes are susceptible to a wide range of long-term complications such as edema, kidney disease, impaired vision, cardiovascular disease, ulcers, and neuropathy. Individuals with diabetes can receive most forms of manual therapy as long as their tissue has good circulation and has no significant neuropathy. Also, it must be free of ulcers. Some preliminary research shows a temporary drop in blood sugar levels after a massage. For this reason, it may be helpful for diabetic clients to take blood glucose readings before and after therapy to monitor and regulate their response. Okay, so we've reached the end of today's lecture, and for assignment number 9, we're going to be using the Thinking Beyond points that are in the Applied Anatomy and Physiology for Manual Therapists, the Archer and Nelson textbook, and in an essay of no less than 200 words, how might you assess a client's stress level, whether or not it is their primary concern? In what ways might intention and visualization act as stimuli to the nervous system and endocrine system? What implications could this have in your work with clients? When someone says, "My adrenals are shot," what does that mean to you now that you understand the adrenal glands? What might this tell you about the mental, physical, and emotional state of that person? And as always, if you have any difficulty with this assignment, you may email me or send me a text message. My office hours are on Thursdays from 4 to 6 p.m. And with that, do have a great week, and I will see you in the next lecture.